Hello, everyone. If you're taking amlodipine for high blood pressure or heart conditions, you're using a powerful medication that demands careful attention. Ignoring key warnings about amlodipine can lead to serious health consequences, from worsening symptoms to life-threatening complications. Today, we're diving into 6 critical amlodipine warnings and what happens if you ignore them, so you can stay safe and make your treatment a success. These warnings cover medication interactions, dietary mistakes, and health oversights that could derail your therapy. Our goal is to empower you with clear, doctor-backed insights to avoid these pitfalls and protect your heart. So, grab a notebook, stay with us, and let's get started. Disclaimer: this video is for educational purposes only and not medical advice. Always consult your healthcare provider for concerns or emergencies. All information is thoroughly researched, with source links in the description below. Warning: never take new prescription medications without your doctor's approval, as amlodipine interacts with 545 known drugs through the cytochrome P453A4 enzyme system. What happens if you ignore it? Mixing amlodipine with drugs like ACE inhibitors, for example, ramipril, lisinopril. ARBs, for example, valsartan, or other calcium channel blockers, for example, diltiazem, can cause severe hypotension, leading to dizziness, fainting, or even syncope. Antibiotics like clarithromycin can triple amlodipine levels, intensifying side effects like flushing or headaches, while rifampin can cut its effectiveness by 50%, risking uncontrolled blood pressure and heart attack or stroke. For diabetic patients on aliskiren, combining it with amlodipine and benazepril can trigger dangerously low blood pressure. Ignoring this warning risks serious cardiovascular complications or treatment failure. Solution: always consult your doctor or pharmacist before starting any new medication. Warning: avoid grapefruit and grapefruit juice entirely, as they contain furanocoumarins that block CYP3A4 enzymes, increasing amlodipine's bioavailability by 15 to 25%. What happens if you ignore it? Consuming grapefruit can amplify amlodipine's blood pressure lowering effects, leading to severe dizziness, flushing, headaches, or even hypotension that could cause fainting or falls. The effect lasts 24 to 72 hours, so even occasional consumption can be dangerous, especially with pink or red grapefruits or fresh juice, which are more potent. In severe cases, excessive blood pressure drops can strain your heart, risking cardiovascular collapse. Genetic differences in enzyme activity may make some people more vulnerable, worsening outcomes. Solution: eliminate all grapefruit products from your diet and consult your doctor if symptoms arise. Warning: don't ignore serious side effects like worsening chest pain, rapid weight gain, swelling, or signs of liver issues, as they could indicate life-threatening conditions. What happens if you ignore it? Ignoring worsening chest pain or new discomfort could miss unstable angina or a heart attack, risking permanent heart damage or death. Rapid weight gain, 2 to 3 pounds overnight or 5 pounds in a week, may signal fluid retention from worsening heart failure, which can lead to pulmonary edema or heart strain if untreated. Angioedema, swelling of face, lips, tongue, or throat, can block airways, causing a fatal respiratory emergency without prompt epinephrine treatment. Liver toxicity signs like upper abdominal pain, jaundice, dark urine, or pale stools could progress to fulminant liver failure if ignored. Delaying action can turn manageable issues into emergencies. Solution: report these symptoms to your doctor immediately for urgent evaluation. Warning: don't conceal medical conditions like heart issues, liver or kidney problems, pregnancy, or allergies from your doctor before starting amlodipine. What happens if you ignore it? Hiding conditions like severe aortic stenosis can lead to dangerously reduced cardiac output, causing fainting or heart failure due to amlodipine's vasodilating effects. Undisclosed liver or kidney issues increase side effect risks like swelling or toxicity, potentially leading to organ damage. Using amlodipine during pregnancy or breastfeeding without guidance risks harm to the fetus or infant, as it passes into breast milk. Conditions like lupus, scleroderma, or diabetes, especially with aliskiren, can worsen side effects or complications. Non-disclosure can lead to inappropriate dosing, escalating risks of severe outcomes. Solution: share your full medical history with your doctor for safe, tailored treatment. Warning: avoid dehydration from inadequate water intake, excessive sweating, or intense exercise without hydration, as it amplifies amlodipine's effects. What happens if you ignore it? Dehydration reduces blood volume, intensifying amlodipine's hypotensive effects and increasing risks of orthostatic hypotension, dizziness, or fainting. In hot weather or during exercise, this can lead to syncope or falls, particularly in older adults with reduced thirst or kidney function. Severe hypotension can strain your heart, risking arrhythmias or cardiovascular collapse in extreme cases. Ignoring hydration needs can turn manageable side effects into dangerous emergencies. Solution: stay hydrated, especially in heat or during activity, and contact your doctor if lightheadedness occurs. Warning: don't use potassium-containing salt substitutes, for example, no salt, salt scents, without medical approval, especially with ACE inhibitors or ARBs. What happens if you ignore it? These substitutes, 600 to 700 mg potassium per 1/4 of a teaspoon, can cause hyperkalemia, greater than 5.5 mEq/L, leading to muscle cramps, fatigue, or life-threatening heart rhythm issues like ventricular tachycardia or cardiac arrest, especially in those with kidney disease. When combined with amlodipine and other medications, the risk of severe arrhythmias increases, potentially causing sudden cardiac events. Early symptoms are subtle, so ignoring this warning can delay critical intervention. Solution: consult your doctor before using salt substitutes and monitor potassium levels regularly. Ignoring these 6 critical amlodipine warnings can lead to serious consequences, from uncontrolled blood pressure to life-threatening emergencies like heart attacks, strokes, or cardiac arrest. By heeding these precautions, you can keep your treatment safe and effective, protecting your heart and overall health. Knowledge is your best defense, and we hope this guide empowers you to avoid these dangers. If this was helpful, hit that like button, share this video with someone who needs it, and subscribe for more essential health tips. Got questions or experiences to share? Drop them in the comments. We'd love to hear from you. Stay safe, stay informed, and we'll see you in the next video.